Good morning, all of you, and welcome to another episode of your show, The View, where we bring you the latest information, the latest news, and lots of good things happening lately. So good morning, good afternoon, or good night, depending on what time you're watching us. And we're joined today with a special guest. We have Dr. Roxana Hixon here. Dr. Hixon, would you like to tell us a little bit about yourself?
Sure. Hi. Very happy to be here. My name is Roxana Hixon. I'm one of the assistant clinical professors within the Department of Pulmonary and Critical Care here at UCLA and at all of you. I have a dual appointment ever since I graduated from fellowship from UCLA, where I work part-time at UCLA and part-time here. And I've been here for the last 5 years and this is what fulfills sort of my journey and my cup, so to speak, being here with the county population. And it's the reason why I became a doctor. So I'm very happy and fortunate and honored to be working here with you guys.
We're fortunate and honored for you to be here, Dr. Hixon. She's going to talk to us about something that's very unique to the San Fernando Valley. And so we'll get that after announcements. San Fernando Valley Pride. This will be happening Saturday, June 28th, and Senator Caroline Menjivar will be hosting the third annual San Fernando Valley Pride March. Again, that's happening on Saturday, June 28th at 11 a.m. The march will start on Van Nuys Boulevard and Sherman Way and will make its way down to the festival that's happening at the Van Nuys Civic Center. The EDI subcommittee will be participating in the march, and we invite all of you to join as well. If you're interested in attending, please email Brenda Yanes. The email should be posted up here, or you can just search her on Outlook, Brenda Yanes. If you want to join, and just sign up through that email. We'll also be having our annual Pride celebration here at All of You Medical Center, and it's the 7th year that we're doing this. So this will be happening on Friday, June 27th from 11 a.m. to 1 p.m. We're going to have music, performances, resources, and some free mini pancakes. Have you had mini pancakes before?
Yes, I remember having mini pancakes. I haven't had those in a while.
These are little mini pancakes. These are awesome. You could put all kinds of toppings on it. You could do the works, which they throw like everything and the kitchen sink on top of those pancakes. So yeah, we're going to have those this June 27th on a Friday. So come on over and say hello. This last couple of weeks, the nursing administration hosted a Nacho summer fiesta. Thank you to the nursing department for their outstanding work and dedication, where they brought all the folks in to have a nacho bar. I was fortunate to be invited to that. They know I like to eat, and so I did my nacho lunch that day. So thank you to the nursing department for that. Nacho Summer Fiesta. Also, something that I'm proud of announcing, we have partnered with the Department of Public Health, and we are launching an accessible kiosk. It's called the LA Community Health Kiosk Program, and we're hosting one here on our campus. This kiosk will be dispensing free COVID-19 testing kits, condoms, overdose prevention products like fentanyl test strips and Narcan, and it's for the public and it's for free. We will be letting the community know that these life-saving products will be available for free on our campus. So it's for our residents to be able to make informed decisions and take proactive steps to look out for their health. So we're a proud partner through this kiosk program with the LA County Department of Public Health. It's going to be located on the first floor lobby to the left. So if you're walking out of the first floor lobby, it's going to be to your left-hand side. And it's available to all patients, community members, whoever would like to patronize it, it's available. Another thing that I'm very proud of is the All of You alert system. So you're probably asking, what is an All of You alert system? So what we're doing is we're creating our medical center emergency alert system, which this means is sometimes you are not working at the hospital and you may not be able to hear a code that's being announced overhead because you're working in one of the cottages. And so you don't know if there's a fire alarm. You don't know if there's a code silver that's being announced. And so in order for all our staff campus-wide to stay safe, we are launching this All of You alert system. What would happen is if there's an alert, for example, there's a code silver on campus, we will be sending this out directly to your cell phone. And you will get a text message, which you will click, and it'll give you the information of what type of code, the location, and also what we need you to do to stay safe. We will not be announcing things like, come and join the farmer's market this morning. Mm-hmm. This system will only be used for emergency alerts that we want to make sure that we're sending out you so you could stay safe here on campus. In order to receive these notifications, you'd have to sign up with your cell phone number. There will be a QR code that you will see on screen. With this QR code, you scan the QR code, you sign up, and then this will allow the system to send you notifications of any campus emergencies, parking lot closures, or any evacuation alerts. This is very important. I recommend that you do sign up. It's not required, but it's highly recommended, especially if you're not around or you're not able to hear the announcements. We can give you up-to-date information. Sometimes overhead, we will not say, not give you the details exactly of the follow-up of these events, but with this alert system, we will be able to do that as well. So this will launch on July 1st. So please sign up and let us know if you have any questions. Send them through our feedback button, or any suggestions, send them through our feedback button. So thank you. And Dr. Hixon, we're here to talk about something that I didn't know until I started here 6 months ago, mm-hmm. of a condition that disproportionately is affecting the San Fernando Valley and specifically young men. Can you tell us about silicosis?
Yeah, so silicosis is a chronic lung disease that is typically caused by inhaling silica dust or silica particles. And the reason why it's so prevalent here within the San Fernando Valley is because we have a lot of stone fabrication, stone countertop cutting shops in the San Fernando Valley. And so that's how we're seeing a lot of, like you said, disproportionately young men who usually come from Mexico or South America, who find these jobs easily either through a family connection or, it's something that a job that is rarely available for many to take. So that's why we're seeing disproportionately young men, Hispanic men. About 98% of cases that we've identified have been Hispanic men being affected by this chronic lung condition. And initially, inhaling these dust particles causes inflammation in the lungs, and that eventually leads to lung scarring, which then makes it very difficult to breathe.
But don't they use, protection when they're working with these products?
That's what we found out through interviewing these men, is that unfortunately, many of them have been working there for decades, some since they were 18 years old or younger even. And no, it wasn't the standard for them to be protected, even though there are some standards through OSHA, like what is considered safe in terms of protection. We found out that a lot of these shops are not really enforcing these standards. And so a lot of men will say, no, not up until the last couple of years have I started wearing like an N95 mask or like an actual respirator ever since we started noticing the rise of these cases. So yeah, unfortunately, a lot of them spent many, many years working without any sort of protection around the stone.
So this sounds like it could be a preventable disease.
Exactly. And that's why it's very important to kind of raise awareness about it, is that when you get the disease, sometimes it usually takes a long time for it to manifest. So you can live years having evidence of disease in the chest, but you can't really tell because there's no symptoms until, unfortunately, it's progressed to the point where people need lung transplants to survive. Wow. And so it's important to raise awareness about this, because if we provide the adequate protection, or if shops provide the adequate protection, potentially we would be able to avoid a lot of these early deaths that are happening.
And I'm told some of these patients are cared for here at All of You Medical Center.
Exactly. It was one of our own staff members, Dr. Jane Fazio and Dr. Kamangar, who noticed in clinic all of a sudden this sort of trend of young men coming in with cough, shortness of breath, unintentional weight loss, and this radiographic pattern that was very consistent with silicosis. And when they caught this pattern, they were like, oh my gosh, like what's going on here? The common denominator is the kind of job that they had. And so, yeah, we actually have a clinic dedicated to just silicosis, mostly silicosis patients, Dr. Jane Fazio's clinic, where she cares for these men. And she sees a lot of new consults very frequently. And so I don't know the exact number of the whole state of California, like what percentage we're taking care of here, but I do know that we do see a handful of patients every single week in our clinics.
Yeah, and All of You Medical Center with their academic partnership with UCLA are always in the forefront of, and I know there's a study for silicosis. Can you tell us a little bit more about that?
Yeah, it's the California Artificial Stone and Silicosis Project that is being spearheaded here within our own campus at All of You by Dr. Jane Fazio and Dr. Kamagar. And so that study is meant sort of to, it spans the whole state of California, and it's meant to kind of recruit workers from this stone cutting fabrication shops to kind of ask them questions about their exposure, what kind of protective measures have they used, and it also provides education to them. We're learning from them, and hopefully they're learning from us sort of the protective measures they can enact to protect themselves. But if part of it too includes like screening for the actual disease. So they get a chest x-ray, a CT scan, just like the best picture we can get of the lungs, and some breathing tests. And from there, we're able to counsel them, like, fortunately, you either don't have it or yes, you do. And then you can come to All of You for care if you don't have the resources, or, if you have insurance, then maybe it's a good idea to establish care with a pulmonologist. And so it's meant to raise awareness, provide education to the public, kind of try to figure out how much of this population is being affected, because we are pretty sure that we're not capturing the magnitude of the problem, right? We're only seeing those that are coming to medical attention or those that we can recruit to the study. And so hopefully we're able to get a better assessment of how much of our population is being affected by this unfortunate, progressive, and deadly disease.
Yeah, I think you mentioned awareness, and I think that's such an important point because, personally, I didn't know this condition existed until I got here. Mm-hmm. And so how can we help? How can our viewers help spread the word or awareness of this disease that's affecting the San Fernando Valley?
Yeah, since it's a popular job here within these young men, Hispanic men, I'm sure that most people that live in the San Fernando Valley will know at least one or two people that work in that job. And so bringing just sort of awareness to them, and then asking them, like, hey, what are you doing at work? What kind of protective measures are you using? Or just even, as healthcare providers, if you happen to encounter a patient who, mentions, okay, I work within this job, just making sure that they're connected to the right people in terms of specialists, but also making sure they have access and know that this is either a study they can participate in, the CAST study, or taking steps towards trying to identify whether they're affected or not.
Where can people find more information on this?
On the CAST study?
Just in general on silicosis?
In general? Yeah. The Cal OSHA has really good information about that. OSHA itself on their website has really good information about that. And there's several publications that have been published, like in JAMA, if you're more of like, someone who likes to read the raw data, that actually Dr. Fazio spearheaded. And she's the first author in that publication that kind of outlines sort of initially what the scope of the problem was and how many of our patient population is being affected by that. So, nowadays everyone has access to a computer, or everyone has access to a smartphone, and you can always kind of look a little bit online about that, either through official channels. At All of You, we also have a little blurb about that on our own website, about sort of a basic about what silicosis is and sort of the people here that are involved in that. But the web can provide a lot of information. And if you, are not savvy with that, you can always ask your primary care doctor, or, approach one of us and ask us more about it.
Such important work that you are doing on this issue, and it's something that's affecting our community, and someone, like you mentioned, people that we know that are working in the industry that could be potentially affected. I want to thank you, Dr. Hixon. I also thank Dr. Fazio for all the work and really spearheading this work here through All of You Medical Center and our community. So thank you very much. If there's any more information, we can connect you to those resources. Send us a message through our feedback button, and we'll share the information with you all. Thank you so much.
Thank you for having me.
Do you know, you've watched The View before?
I have, yeah.
Do you know we do a trivia of the week?
That, I may have stopped watching before that. But
Oh,
no.
okay.
I usually watch like the first
I
10
watch
minutes.
every week.
I know, right?
I know you're busy. I know you're busy. But when you're at home, on the weekend, relaxing,
The
just
kids are
open up.
asleep, and
Yeah,
then
that's
I'll do
right.
that.
Or you can watch with the kids, right? Make it a family thing. All right. So this week's trivia question, actually last week's, we're going to answer last week's and announce who the winner is. So last week we asked, what large body of water was created in the valley to help Los Angeles's water supply? And the answer is the Van Norman Reservoir. I don't know, have you heard of the Van Norman Reservoir? I have not either. I wonder if you could go fishing there or boating or skiing. But the winner of this week's gift card, of my gift card, and I'm running out of gift cards. So the winner is Elizabeth Nieves Robbins, and she is a senior clinic social worker. So congratulations, Elizabeth. Come on over to administration, talk to Grace, and she will give you your gift card. So congrats. And so as is customary, we're going to switch it up a little bit. We're going to make it a little bit more fun. Maybe the newer generation may not know the answer to this, but I know, once I read the question, I knew exactly what it was. So what popular game involves removing plastic pieces without touching the metal sides and triggering a buzzer? So there's a game that we used to play when we were kids, and we had to look for these plastic pieces, and you couldn't touch the sides or else you would trigger a buzzer. So if you know the answer, you're the first one to answer this. Put it in the feedback button, and you might win a gift card. All right, on to shout-outs. We want to shout out Giselle Rodriguez, an RN in 4A, Mary Obando, an RN in 4D, the night shift, and Mercedes Oseguera, a nursing attendant in 4D and medical surgical unit. And the patient wanted to thank these folks for being friendly, respectful, caring, courteous, and helpful. Thank you, Giselle, Mary, and Mercedes, for doing the work that you do every day. It's special work. You make an impact to the patient. The patient wanted to thank you all because how you cared for them, they'll always remember that. So thank you so much. And on to executive rounds. We visited different departments. Have you heard we're doing this now in executive rounds? Yeah. So the executive team is visiting every department on campus. It's taken us we're about month 3 and more than that, almost 6 months. And every week we visit a different department. This time we went to facilities management. And as you all know, facilities management is so important to the operations of this medical center to ensure that the clinical teams are able to do their work in a safe, functional, and welcoming environment, from daily maintenance to repairs to construction projects to innovative ways to deliver or make a safe environment to deliver care. This team makes it possible. They work directly with the clinical staff, the patient care departments, and they provide that foundation to make an environment safe to deliver that care. So thank you very much to the facilities management. We're proud to recognize you guys for their hard work and commitment. So keep up the great work, and you are the folks that keep our hospital running strong. Thank you so much. We also went to the finance department, and the finance department is also very important because without money, we wouldn't be able to deliver care.
This is true.
And so the All of You finance team are responsible for managing all financial processes, including tracking expenses, forecasting expenditures, and also generating financial reports so that leaders of different departments are able to have the information to make the right decisions for the best care for our patients. So they're a key component in the process. Thank you for all the work that you do. They also review our contracts. They're the contract auditors. They're the contract managers for all the different contracts we have here on the campus. So thank you very much for their work. As we hospital leaders strive to control expenditures to ensure that we're fiscally solvent for future years, and that we're here to continue to do the great work that we provide the community. So thank you, Finance Department, for your extraordinary work. All right. We have feedback button inquiries and also comments. We'll start with automatic doors. This person writes, We want to request automatic doors to safety and difficulty staff face when transporting patients with gurneys and wheelchairs. And I think they're talking about the ER doors. And this has come up a couple times during our executive rounds, and it's also been a previous question in our feedback button. And so, yeah, we actually have a plan for that. It's in the priority list as we move forward. It's a capital construction project that we have to start, and we will be starting that soon. So thanks for the feedback, and it is on our list, and we will be addressing it soon. In terms of overtime, as we're talking about, fiscal financial expenditures and being better stewards of how we use our resources, this person asks, staff are asking why long-term RN travelers are still being used despite efforts to cut overtime. May I suggest a more cost-effective method is to offer OT and to hire our current permanent employees rather than using travelers. That's a great suggestion. And I know this is specific to RNs, but in all contracted registries, we are having our clinical leaders take a look at that and really reduce our reliance on registries and more on our permanent employees. So that is something that those are efforts that are currently taking place for our clinical leaders in our department. So great suggestion, and thank you for that. There's a shout out for me. Thanks for being a proactive leader since you have been here. It's kind of hard reading all that about me. I'll just pick and choose. Everyone wants to be seen and heard, and he makes all of you employees feel that way with his engagement and dedication to listening to us. Yes, absolutely. I said it in many spaces, any opportunity that I have to meet with staff. I really, truly feel that the great ideas come from you all. And so the more information I can receive from you all, the creating these communication lines between staff and leadership and all the folks in the campus that make it great. We need your information. I want to make sure that one of these things as we visit the different departments, I want to make sure that folks know that it's not just clinicians that do the work. Obviously, clinicians are important, our nurses and our physicians and our clinical ancillary staff, super important. But there's a lot of other departments that are part of all of you that make all of you such a wonderful place and an amazing place to work. So yes, if you have anything else you want to hear, you want to see, let us know. We want to make sure that you all are heard and part of evolving this medical center to one of my goals is reaching the Leapfrog A. So yeah, thank you so much. And they also said, looking forward to the Olive Lounge becoming a space for all employees again. Yes. Did you hear about that?
No, I didn't.
All right. So in the cafeteria, there's a space that was a physician-only space.
Yes, the fishbowl.
Correct. And the medical staff here at Olive Medical Center were amazing partners, and we're willing to open that up to all. And so we're creating an Olive Lounge that's specifically for all staff only, where staff can have a place to, unwind, and it's closed off a little bit, so it's a little semi-private, and we have a lot of good ideas for the Olive Lounge, and so it's open to all staff now as we continue to add more things and make it a special place for our staff. So there's another question. Does Edgar want to be called Mr. Solis or Edgar when we see him in the hallways? She called me buddy when she walked in. She's like, hey, buddy. So I was like, no, I'm just kidding. It doesn't matter. It's up to you. Whatever you feel comfortable with, I'm fine. I've responded to Oscar, Hector, Edward. That's fine. You can call me whatever you'd like, Edgar or Mr. Solis. It's up to you. Either way, as long as you say hi as I'm walking the hallways, that's all that matters. Thank you so much. And there's a question from the NICU. Will Edgar be visiting the NICU? Amazing team. Most often the unit is ignored because people are scared to go in there. They're right. I'm scared to go in there. I'm a nurse, and part of my rotation, like the most nerve-wracking rotation that I had was L&D and pediatrics. Mm-hmm. It's just the babies are so special, and and but it's just amazing work that the NICU staff does. And yeah, I've actually been in the NICU several times to visit both night shift and day shift. But they are on the list for the executive team rounds. It will be coming soon. So absolutely, I'm sorry you feel ignored, but I hope you understand that people understand the great care that you provide, and so specialized working with those babies that they're probably, they might be a little anxious to go in there. So yes, we will be visiting the NICU soon. And lastly, we have some feedback. A great episode. You should have Christian as your guest again. He was great during his episode. Yes, Christian was a natural. So thank you. Yeah, we'll be visiting. We'll be having special guests. We'll invite Christian. There's a lot of feedback for Dr. Waterman as well. So we'll have him back as well. So if you have any other people you would like to see, thank you, Dr. Hixon, for being here and sharing the important information and work. I'm sure you're going to get asked to come back again and talk about a little bit more about what we do here in terms of the work over with silicosis. But thank you all. We reached the end. How was it? Did you enjoy it?
Yes, yes.
All right. So you're going to be watching really quick. All right. I know you're going to watch your episode, right?
I don't know. I hate watching myself.
All right. So thanks, everyone, for tuning in. Please reach out with information questions on that feedback button. Sign up for that All of You alert system. Look into the great work that our clinicians are doing with silicosis, and learn more about that. Tell your neighbors about it. If you know someone that works here, have them reach out to us, and we'll connect them to ensure, because this is a preventable disease. And so whatever we can do proactively to prevent the disease, we can hopefully eliminate this. So thank you all, right? That's the goal. Thank you all for tuning in. Stay up to date. We have our All of You YouTube channel, and we have the Instagram account. So stay safe. Please help each other and be kind to each other. And we will see you in 2 weeks. Thanks for tuning in. Hello, I'm Edgar Solis, and I'm the CEO at All of You Medical Center. And I want to invite you every first and fourth Wednesday of the month from 9:30 to 11:30 to our produce distribution event happening here on our campus. It is completely free to the community, so come on by from 9:30 to 11:30 to get your free bag of produce. We're offering this in partnership with the Los Angeles Regional Food Bank, CalFresh, and the Department of Public Health. So come on by and see you soon.